What's going on, guys? My name is David. I am trying to do some more long form content on YouTube, so figured this was a good opportunity. I am presenting some work on deep brain stimulation in a journal club that I started on campus, so I figured that I would pre-record my slides and my talk in case anybody comes across this, wants to see it. But basically, just some background. This is a just an introduction slide. This is me on the left in active addiction about 7 years ago. That's what I looked like, and this is me today as a medical student. And everything's changed because of recovery and because of getting sober. And this is why I'm very interested in this field of medicine, and I really hope to serve this population in one way or another. But yeah, this is me as a first year in my white coat. This is me holding up my 6-year coin. See if I have a laser pointer on here. And yeah, me with some family, me with some good friends. So my credentials, I really don't have much credentials. I'm a second year medical student in an MD program in the United States. I'm over 6 years in recovery. I will have 7 years of recovery, God willing, in April of 2026. The big ones for me were crack, cocaine, and alcohol. I've gone through multiple treatment centers. I've also done a lot of 12-step programs. I'm still heavily involved in 12-step programs. I'm an addiction researcher, although I'm not published. I do a lot of addiction research. I'm very interested in it. I'm also a sober coach online, and I have a heavy interest in neurosurgery and addiction medicine. So that's kind of where a lot of this passion comes from. And this presentation with DBS and addiction is kind of a mix of both of those fields, which I think is really cool. All right, and yeah, let's connect. This is my Instagram plug where I do a lot of posting. I share stuff about my life. I'm also into other things outside of just medicine. I'm a big worker outer, and I sober coach. I help a lot of people, and I like to write and do a bunch of addiction related things. So if you're just seeing this for the first time and you don't follow me, check me out on Instagram. I'd love to connect with you, especially if you're in recovery or if you're struggling. Would love to connect. And you can also subscribe to this page as well. I'll be hopefully putting out some long form content, being that my schedule doesn't get too busy, but we will see. All right, so let's get into this. So, deep brain stimulation for substance use disorder, a systematic review and meta analysis. This is the main paper that I looked at because honestly, I looked in the literature and this is the best one. This review and meta had the most amount of patients, and there were some other ones, but they weren't good. They didn't have a lot of patients. I didn't look too much into them after I saw the methods and just saw how many what their sample size was and how many papers they included and stuff like that. This one looked to be the best, so this is what we're gonna go with. Although I did kind of pick from a few different articles as well. So while that's the main article, there's some other stuff from these other two papers, which really aren't metas, but they're just reviews. I kind of got curious and read into those as well. All right, so overview. Substance use disorders is a chronic relapsing mental condition characterized by compulsive and harmful use of substances despite consistent negative consequences. Conventional treatments nowadays in 2025 include pharmacological and behavioral therapies, usually combining those two things, so psychopharm treatments. But still, with those things, it's very limited long-term success. So substance use medications like naltrexone and Suboxone, and then 12-step programs, psychotherapy, et cetera, et cetera. Again, usually those two things are combined. But regardless, even though they're combined, there is still a very, very low success rate in 2025. So that's kind of what sparked the DBS world to kind of get interested in this, because DBS, or deep brain stimulation, when I say DBS, it's deep brain stimulation, and we'll get into what that is in a little bit. But DBS is kind of seeing that they're treating other mental conditions like OCD, depression, anxiety, Parkinson's disease. And I think the thought is, well, why wouldn't this work for addiction too? If it's working for OCD, if it's working for depression, why wouldn't it work for addiction? And the rationale is just to target and modulate the reward circuitry in the brain, in the deep brain specifically. And we'll get into the exact mapping of how this stuff works. All right, so why is this important? Most of you guys, if you're watching this, probably know substance use disorders are a huge thing in the US right now. They're accounting for a lot of deaths. If you're in recovery, you probably know people who have died You probably have close friends that have died. Even if you're not in recovery, you probably know of people who are passing away from alcoholism or some sort of addiction. So 500,000 deaths annually in the US alone, and 85% of individuals who struggle with addiction experience a relapse within the first year after attempting abstinence. So this number is not the best. By not the best, I mean it's there's really like not a good number. This is kind of like an estimate. It's a ballpark, I would say. And this 85% is including people with and without treatment. So depending on where you look, you'll find like some different numbers, but this is about like the average from a few different sources that I came across. And then obviously too, like smoking is a huge risk factor for multiple other diseases. And you have a bunch of people that like actually want to stop smoking, but they literally can't because they're so physically dependent on it and their brain is so hooked on that release from nicotine and that like they 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 have everything. They want it so bad, but they still can't do it. So if we could figure out a way to kind of give these patients another option to quit smoking, then we would cut out a huge risk factor that causes multiple other diseases, cardiovascular, pulmonary, etc. So there's a lot of important things hidden within this work. All right, so the history of neurosurgical care in substance use disorder. I thought this was interesting. Doesn't really pertain to the paper, but I thought it was interesting, so I want to talk about it. During the 1960s, neurosurgical procedures included things like a cingulotomy, hypothalanotomy, and a substantia anom I can't even say that word, resection. And they were attempted in treatments for substance use disorder. However, their success rates were limited, so I kind of just put on the slide where these specific brain areas are, and you can see that they're in the deep tracts of the brain. So you can imagine in the 60s them going in and literally like, in the case of the hypothalamus, like resecting these areas of the brain out of the head. And in the case of like the craniotomy, like literally like lesioning this whole entire part of the brain just does not sound fun. And for obvious reasons and ethical reasons, this is no longer a thing. But in 2025, we now have deep brain stimulation, which seems to be very, very successful in other avenues that aren't addiction right now. But Parkinson's is a big thing that deep brain stimulation is kind of really taken care of in a big way, not curing, but prolonging a lot of function in these patients. And for those of you that don't know what deep brain stimulation is, I'll kind of run through it a little bit here. But basically, it's a two-part surgery. At my institution, it's a two-part surgery. I've actually had the pleasure of seeing one of these surgeries, which was so cool. We have a surgeon here who does them. He's very good at them. He does a lot of them, and basically what they do, the first part of the surgery is they open up the head and they place this big electrode down deep into the brain. It's very precisely placed, and depending on what the patient is struggling with, I think they do some brain mapping too before they do it, but depending on what the certain situation is, they place the electrode where they think it'll be most beneficial. So it could be like usually all around the same area if it's Parkinson's, but they will kind of tailor it to the patient's needs based off of their brain scan. And they thread this long electrode down into the brain, and then they close up the head. The patient wakes up, patient waits a couple more days, patient comes back in for a second operation. And the second operation is where they place this neurostimulator down here in the chest. And this is basically just like a battery pack to keep the electrode firing. And that's placed in the chest. So they cut a hole in the chest, they put it there, and then they thread this wire all the way up through the neck behind the ear, connecting it to the top of the electrode. And then this is all connected via some sort of app that allows them to like stimulate these tracks deep down in the brain. And for the neurostimulator too, I believe that you have the option of getting the battery taken out and replaced like every 10 years or so when it runs out, or you can get a neurostimulator that actually charges magnetically over the skin, which is pretty cool. But yeah, really cool surgery, really cool stuff, and only going to iterate and get better, which is the really optimistic thing about this. But as I said, relevant targets kind of differ depending on what you're trying to treat here. So Parkinson's disease, which is by far the most prominent reason people are doing deep brain stimulation, is targeting the subthalamic nucleus. And then you got things like essential tremor that DBS is really good at helping with too, which is basically like a big Parkinson's symptom as well. And you can hit the thalamus. You can see OCD is on this list, targeting the nucleus accumbens, and that's also what the big addiction target is too. So keep that name in mind. We will be spending a little bit of time on that. And then you can also see major depressive disorder on here too, and epilepsy. So DBS really, we're trying a bunch of different things, and we're seeing if it can potentially, have some beneficial effects in these patients. So like I said, the nucleus accumbens is a specific part of the brain. You can see it right here by the red arrow. It's this little circle here located in the deep anterior brain, and it's a key structure in the brain's reward system and motivational circuitry, and a key player in dopamine modulation. So when we're talking about DBS and we're talking about addiction and we're talking about substance use, this is the gold mine area where we're going to be placing that electrode so we can stimulate this in hopes to modulate that messed up or hijacked reward system, in hopes to kind of reset the patient's reward system. All right, so that was kind of the background. So let's get back to the study. Let's get back to what this study found. So the objective was to evaluate the efficacy of deep brain stimulation in treating patients with substance use disorders and reducing relapse rates through systematic review and a meta-analysis. So their methods were pretty strong. So they used a systematic review and a meta-analysis following Prisma guidelines. They searched a couple of different databases, including PubMed, Scopus, Ovid, and Web of Science. They included studies that were human studies, obviously, English peer-reviewed clinical outcomes after DBS for alcohol, opioid, and nicotine addiction. And for their analysis, they did a random effects model using a program called R. They also ran a heterogeneity test, a Q test, subgroup, and meta regression by age, drug type, and years addicted. So the study characteristics, they included a bunch of studies, but after they went through and included further, they knocked it down to 16. And those 16, out of all those 16 studies, they had a total patient number, total patients that underwent DBS for addiction of 50. And the mean age of those patients were 43 years old. Most of these patients were male, at 82% being male. And the mean duration of their addiction before the DBS placement was 16 and a half years. And the follow-up, which just means how long they followed these patients in the research project after they had surgery, after they got their deep brain stimulator, was 16 months. And like we talked about, the DBS target was the nucleus accumbens, that specific area of the brain that's heavily involved in reward. And some studies even had a little bit slightly different targets, like the anterior limb of the internal capsule. But again, and there's a picture of that actually right here too. But you can see that that is kind of in the same exact area of the nucleus accumbens. So, this is going to be the hot spot for these patients when they're getting that electrode placed. And they looked at alcohol, opioids, and nicotine. All right, so what did this study find? So the study found that there was an average of a 59.6% improvement on addiction scales overall, right? So this finding was also significant, and the follow-up, as we talked about, was 16 months after surgery. And, going back to the earlier slide, it should also be noted that the psychopharm therapies that are currently in use for addiction are typically anywhere within the 35 to 55% improvement range. And again, numbers vary by source. I've seen this number as low as 5% and 10%. So it really depends like where you're looking, but in general, 35 to 55%. And then the DBS coming in at almost 60% seems pretty promising. And then the relapse rate, they claimed their relapse rate of being 8% versus the typical 85%, like we talked about earlier, of patients that are with or without alcohol treatment. 85% of them are relapsing. So obviously, they knocked down this relapse rate very, very, very much. And then their pooled effect size, which just means they looked at all the different studies, right? Because they took 16 different studies and kind of looked at all of them. And the pooled analysis, so all the studies together, showed the 55.9% increase, and somewhat of a large confidence interval here, the 40.4 to 71.4. So that kind of knocks down the that kind of knocks down the um, the credentials of that number a little bit, but still a relatively solid finding. And then the heterogeneity, which is just how inconsistent the studies were with each other, was relatively high, so 92.6%. So that they kind of have going against them because the studies are kind of like very inconsistent. That's not like the best look when you're looking at, different papers trying to see if DBS is actually helping patients or if it's actually not. And then the publication bias, which is just a specific test that you can run, and it kind of shows like how likely your results are to include some sort of bias or some sort of overestimation of positive effects. And again, that test for them was 0.01, indicating that there's probably bias present. There's likely some sort of like overestimation of the positive effects. So on top of the pooled analysis and overall meta, they also did a subgroup analysis where they stratified by age, and they kind of showed that the older the patient, the stronger effect the DBS had. They also stratified by substance type, so they looked at alcohol only, opioids only, nicotine only, and the biggest improvement that they found was in alcohol at a 61.3%. Again, confidence interval kind of wide here, so that kind of knocks down the validity of that number just a little bit, but still pretty solid finding. Opioids, again, too, they found 56.4%, which is pretty solid. And these both of these confidence intervals do not, you can see that they're both positive numbers. They don't cross the number 0, so that indicates that there is significance in these findings. It is not just by chance. DBS is likely actually causing these benefits. And then you can see nicotine down here at 48.5% improvement. But if you look at the confidence interval, you see a -19 all the way up to a 116. That is not a good confidence interval. This is not a significant finding, so it's unlikely that DBS is really having any effect here on nicotine. Uh, by duration of addiction, the longer the addiction was correlated with a stronger DBS response. And they also did a sensitivity analysis showing that no single study significantly altered their pool effect, which is good. And now getting into some of the figures in the study, I know this is a lot to kind of look at, but just kind of look at these boxes in this line here. Everything on this line signifies that there is like 0 effect, so DBS just isn't helping or isn't hurting. And everything on the left of the line signifies that DBS didn't work, and everything on the right side of the line signifies that DBS did work. So you can see a lot of these boxes are on the right side, indicating that there is some sort of likely positive effect regarding DBS. And this is going to be the specific analysis per each addiction. And you can see they split up the studies by alcohol, opioids, nicotine. And you can see that, again, a lot of these boxes are on the right side of the line, indicating that there is a beneficial effect. And again, alcohol and opioids had the best and the most significant findings compared to nicotine, which wasn't correlated to any kind of significance. So it's hard to say that DBS really had the positive impact that the study claims on the patient struggling with nicotine. All right, so discussion. So deep brain stimulation of the nucleus accumbens is significantly reduces cravings and relapse in severe treatment-resistant substance use disorders, especially in the older population, and especially when considering alcohol and opioid use. So the mechanistic basis, again, is trying to modulate the dopaminergic reward pathways in the nucleus accumbens, and the clinical implication is trying to push for the potential neurosurgical involvement in these patients and in addiction treatment. And the limitations of the study, we already kind of talked about a lot of these, but small sample size, 50, which in my opinion, like isn't terrible because there's just really not a lot of patients getting this surgery right now. This is a very, very new thing. And I also read in one of those review papers that a lot of these patients like don't really want the surgery because a big part of addiction is the denial piece. So a lot of these patients like don't really, they kind of downplay their problem. They don't have a lot of motivation to get better, as opposed to the patients that have OCD that are just kind of in their head all the time, like thinking about how they want to get better and obsessing over how they want to get better. It's kind of harder to recruit patients who are in active addiction. And then, there's also like the homeless piece, and like these patients are just like they're craving their next fix and stuff. It's hard to get these patients in the operating room and get them committed to treatment. So that's a big limitation when considering DBS for this specific population. And then, like we said too, we had the publication bias going on, so that's not the best look. And then there's a lot of ethical and selection concerns as well. Is it ethical to really be doing this to patients? Especially when there's not a lot of data on it. Like, should we really try this out? Is it too much of a risk, et cetera, et cetera? Okay, so conclusion. So for those of you wondering, right? Deep brain stimulation does show moderate to large benefit in reducing alcohol symptoms and opiate symptoms and relapse. It does show that. It is correlated to some sort of significance when you're looking at this study in particular. Some of the other metas that I looked at, again, I didn't look too deep, but some of the other ones didn't have as great numbers. Again, this is like the biggest meta that I found. And it looked like the most accurate one in terms of like their larger sample size compared to the other ones. But not all the metas showed like really good numbers. Like not even that these numbers are like fantastic, but there's definitely some significant findings in this study, and some of the other papers I looked at, like I didn't see as high of numbers. And with that being said, it's like we definitely need more numbers to really know, is DBS actually benefiting these patients, or is it hurting them more than it's benefiting them? And then again, just to reiterate, I think like the biggest thing about this study, the 8% increase, the 8% relapse decrease from the 85% benchmark is obviously like a huge jump. And like I said, we need more randomized large scale trials to really establish like the efficacy, the safety, and the optimization of really doing this. So we'll see what the future years hold. And DBS may represent a future neurosurgical adjunct in addiction medicine. I mean, I think it would be really cool, right? Like addiction definitely centers in the brain, centers in the mind. And this takes me back to the one quote in the big book that says, science may one day accomplish this, but it has not done so yet, right? So how close are we to coming up on that yet? Are we almost there? Is DBS kind of like the pathway that's going to lead us down the road to really curing this, or really helping these patients out, like helping them out better than like the 35% success rate of psycho and pharm therapies that we got right now? So yeah, it's really I'm really optimistic about this. And obviously this was like a very cool study for me to read because I'm interested in neurosurgery. I have a whole past history of being an addict, being an alcoholic, and very interested in addiction medicine as well. And it's like two of my favorite things kind of coming together on the same level. Another interesting thing for DBS might be exploring different targets in the brain. Is the nucleus accumbens the best target for these patients? Should we be looking somewhere else? Should we target the nucleus accumbens in a second location? These are all questions that we should ask, and questions that will probably get answered within the next decade. So if you watched it this far and I didn't bore you to death, thank you. Again, follow me on my socials, subscribe to the channel. I'm going to be trying to do some more long form content like this video. I might also do some like maybe day in the lives. I might do some like sobriety specific content, some tips, how to stay sober, how to get sober, more into my life, more into how sobriety changed my life, and stuff like that. But yeah, thank you so much for listening. Again, subscribe, follow me on Instagram,